at the legs, we're gonna go again like with the upper extremities. We group them. So we're gonna have some muscles that, well, what are they gonna do? We have some muscles that move this stuff around. So we're gonna have some muscles that bring the leg up, we're gonna have some muscles bring the leg out, we're gonna have some muscles bring the leg in, and then some to the back. Agree?
Yes.
And then we also have some bringing it, rotating it out, and some rotating it in. That actually happens up here, that motion. Shake that booty. And there they are. Look at how pretty they look. So the first group of muscles I want to look at are called the lateral rotator muscles. And the lateral rotator muscles are attached pretty much, well, if you look at the muscle in the back of the butt, they're pretty much all attached like around here, and then reach up around the crest, up to the front, and then it pretty much go out like this, like a quarter wheel or something like that. And most of them gonna be attaching into the greater trochanter, and then some reach down a little bit further to the outside of the thigh. And so that pretty much explains the glutes and then those lateral rotators as well. And the abductors as well. So the lateral rotator group is the one we work with is the piriformis muscle. There's a couple more to it. I named them here, gemellus and all that. If you want to learn more, you go down here. And that attaches actually the front of the sacrum. It reaches out to the greater trochanter, and it's a very interesting muscle. Because when it does that, it goes from here, it reaches out, and it does that, it pulls the leg out, and it laterally rotates the leg, the thigh, the foot. So if you see somebody standing like that, you know their right piriformis is probably tight. The other thing that piriformis does that's really interesting, that's not really in the textbooks, is since it attaches on both outside thighs and goes into the sacrum and grabs the sacrum, and it's big. If you look at it, the front of the sacrum, this area is all piriformis attachment. It's big. And what it does, it's gonna, by grabbing the sacrum from both sides, it's gonna stabilize the spine. So if we walk and the spine moves around, that muscle contracts and balances out to make sure the spine is not crooked to one side. And as a matter of fact, often what I find clinically, one side is goofy and is contracted, and the sacrum moves over there a little bit, and the hip moves up on that side a little bit, and it's usually the side on the right side because we're walking, we're driving and pushing all these pedals and turning the foot out and in and do all that stuff with the right side. And so then the spine does come up a little bit crooked and has to balance up here, and this down here can get painful and ouchy. So that's an interesting muscle to actually release massage-wise. It's one of the ones that I work most of the time. And most of the time on the right as well. Oops. So that's the lateral rotators. So then we have a group of muscles that do hip abduction. What's that? Away from the body. Adduction is adding to the body. AB is away from the body. So thinking about it, where are we going to attach these muscles that we want to move the leg out, away? Are we going to attach this way? Are we going to attach these muscles on the inside, on the outside, in the back, in the front? What do you think? Maybe here?
Yeah.
To pull it out?
Yeah, inside.
So like out here that way and then pull it out? Yeah. So like here this way? Good. So that's where they are. So they are there, that's the glutes and the tensor fasciae lata. So if I look at the glutes, I have a few glutes. The top glute, this glute, is the gluteus maximus. There's the Brazilian butt right there. And then the next one below, so we take that away. So they cut that, so this is the gluteus maximus. They cut that away here. The one below, right here, is the gluteus medius. No, that doesn't work anymore. Gluteus medius. And then underneath that, we have one that's called gluteus minimus. Medius and minimus. We're going to look at them as the same. Gluteus medius and minimus is the same muscle for us. Because they both go from in here and reach out to the greater trochanter. And when they contract, so they're going to attach in here. You're going to go to the trochanter. When they contract, they're going to pull that trochanter up and out. So that's going to abduct the hip. They're from here going to here. When they contract, they're going to yank that up. And then we got, so that's medius and minimus. And then the maximus lays on top. And so it's like coming from back here. And then the max goes a little bit here by the bone, but then mostly goes into this wide fascia on the side. That's called the IT band, iliotibial tract. That's the wide stuff. Oh, we're going to go to those in a second. And then in the front of the crest, you also have a muscle that's pretty much attached to the ASIS in the front here, and also reaches down into this IT band. So you got a muscle from the front and a muscle from the back that can contract. And guess what? That's also going to do that. The TFL is going to move a little forward also, and the glute max backwards in extension. That's a big function that it does, is extension. But it also does abduction. And when I look at the model, the top muscle is the glute max. When I take that off underneath, maybe it shows up, I got the gluteus. Well, that's going to be the minimus, but we'll just call it, it's just the gluteus medius minimus complex for us, sort of. But then this muscle here, where you see the nerve coming out, the yellow things on nerves, that's the piriformis. Right there where the nerve comes out. So you can see that there. And here on the outside, that white stuff, that's the iliotibial tract. Wherever that was. The ITB, iliotibial tract or iliotibial band, ITB.
Could you just show us again the max, the minimus?
Yeah, the minimus is here.
Okay, that's minimus.
And where the nerve is the piriformis.
Right here?
Right above the nerve. Right above the yellow.
Okay.
And in the front here, I can see the TFL, the tensor fasciolatum. You can see, when you look at the front big muscle, goes up and down in the front.
Okay.
Right next to it,
Front, yeah.
right next to it, that's the tensor fasciolatum. That one. See that right here?
Right. So
That's right here.
That's right there.
That's the front, that's the back.
Okay. Yeah, no, I know.
Well, it's hard not to get confused.
Yeah.
No, I'm not trying to be facetious at all. It's very difficult when you try to integrate this information the first few times. So that does abduction. So we got a few of those glutes, the butt. That's a good stretch. That's a foam roller person. Have you heard of foam rollers? Squeeze a muscle, squeeze the blood out of the muscle to relax the muscle is kind of the concept. And there they are. Then we're gonna have to bring the leg up, the thigh. Bring the thigh up. Now where would you think those muscles are? You think those are in the back or in the front? Front, bring the thigh up. Front, right?
Yeah.
Most likely. So for this motion, the muscles are most likely here in the front. So we have the iliopsoas that starts all the way, the vertebra on the lumbar spine, and goes right into the lesser trochanter. So that's the inside of the thigh, right here. So that muscle comes from here, and actually, it also has a portion that comes right from the internal iliac fossa in here. And it reaches underneath the inguinal ligament into the lesser trochanter of the thigh. And when he pulls on it, it contracts. It's going to raise that thigh, flex the thigh. The psoas is good. Look, the psoas, see, gives a lot of people back pain. So if you're driving in a car and you're sitting there all 5 hours, whatever, and you don't get out of the car, and then you stand up and go like, oh, that stretched me out. These front muscles, they've been contracted so long, they're going to get glued together. So you got to make lunges, want to make sure you do some lunges to feel the stretching here, to stretch them out. Because a tightened psoas can give you a sore ass. And you see right here, that's the pain pattern that a psoas can give you. It's kind of a fairly common one because it's not that easy to work. You got to go deep in the belly. So you bring the leg up and then go and massage it. So it takes a little bit of, got to go through the gut. So that's good. That's flexion. We have one more that's going to help us with this. Actually, the top here is going to help us a little bit. When we get to that, we'll talk about that.
Can we see the psoas?
Oh, yes, model. Oh, yeah, thank you. Thank you. Hold on, let me get it. Oh, that's when we take all the things out. Model. Come on. So the psoas is right in here. You see that sausage going up and down? That's the psoas. The next to it will be the iliacus, but they group it together and just call it iliopsoas. As in psoas and iliacus. There's two muscles. So in the textbooks, you most likely in later classes they're going to differentiate them between the psoas and the iliacus. But the iliacus comes from the iliac fossa, from the ilium, from the hip. And the psoas comes from the spine. And they both go to the lesser trochanter on the inner thigh. You can't see that in here. It's a really cool muscle. And that, you bet that can be antagonist. That's one that is very nice to be visualized.
So
Good.
we name them
Whatever's on the list.
okay.
Together.
Yeah, don't make it more. Yeah, and if there is a question, I'm not going to ding you for that. Don't get anxious about that little detail stuff. We'll work that out if it comes up, or you call me over and I'll tell you. Yeah. When stuff like that comes up, I don't want you to get hung up with those things that are those kind of questions. I will guide you through it. If you show me that you know what you're talking about, I'll guide you through it. Yeah. If you don't, too bad. I'll go in the background and see, like, how much time does this person spend on the class? No. So now, next, we have muscles that go and do some work on the knee. Well, wait, we haven't done this motion. We've done this motion now. We've done this motion. I talked about the glutes. The glutes also extend. But what we haven't done is we haven't brought the leg back, so it's stuck out here. So when you need to bring the leg back to the midline, where do you expect these muscles to be? Out here or down here? Inside, right? Yeah. So those muscles are most likely attached here as close to the midline as we can get, and on the thigh to bring that back in. Those aren't the ones. Let me get to the ones. There they are. The adductors. Adductor muscles. Further down a little bit. The adductors are kind of cool. There's a whole bunch of them. I mean, these muscles are massive. They're stabilizers. When you go sideways, they're going to stabilize. They're going to push it in, the leg, so you're not falling off over. So they're really strong. And some of them go to the pubic area in the front, and then some go to the sit bone in the back. So you can just see how that creates this like almost a triangle where you can have a little more this way and a little more this way. So that. But we want to bring the muscle from the thigh to the closest midpoint as we can get to the midline, so we can have as much force to bring it in. Because obviously we can't go this way. We need some space in between to walk. So that's the adductors. Guess what the adductors do? They adduct the thigh. That's why they're called adductors. All right, then we go to the knee. And when we look at the knee, we got pretty much two motions for the most part. We got flexion extension. The knee doesn't do too much. So we have muscles that flex, we have muscles that extend. Where would you find the flexors? Where would you find the extensors? Yeah, makes sense, right? But I wanted to approach it from the knowledge perspective, not the like just memorizing the muscle. I know that's a little much to ask, but still we could try. So in the back, we got the hammies that flex the knee. When we look at the hamstrings, there are four of them. They all start at the sit bone and they go down to the tibia. Two go to the outside and two go to the inside. You see them? Oh, you took them off. The one that goes to the outside is a single muscle, is known as the biceps femoris. Because biceps means two heads. It's not the biceps brachii, it's the biceps femoris. And you can see that down at the bottom. On top you see two heads. No, you don't. Yeah, you can see a little bit, but not really. On the bottom you just see one solid thing. So don't be confused because the muscle on the other side at the bottom looks like it's got two. But those aren't two heads, those are two individual muscles. And one of them is called the semitendinosus and the other one is called the semimembranosus. So where you see in the back where there's two of them, the one on the bottom, if you look distally, you'll see one on the bottom is flatter and the one on top is rounder. You see that? The rounder looks like a tendon, like an Achilles tendon, a round tendon. That's the semitendinosus. And the one underneath that sort of cradles the tendon a little bit is wider, and that's the semimembranosus, like in a membrane. I will call them. But when you look distally, where it goes into one muscle, it's the biceps femoris that goes to the pinky, that's on the outside.
Okay, so this is...
On the medial side, we go to the big toe, that's where we have the two muscles, they're overlaying. The one on top is the semitendinosus, the one below it, underneath it, is the semimembranosus. Whew! I know, huh? So now we flex the knee. Now we got to kick the soccer ball and extend the knee. And those muscles are in the front. Those are our quads. You heard of the quads, right? Unique quads. So you can get off a chair. So the quad means what? Four. So the quadriceps are four muscles. On top, we got one that goes up and down that has this wide thing in the middle. This tendon in the middle. That's the rectus femoris. Femoris femur, rectus straight. That muscle actually goes from the knee, they all go to the kneecap. All those muscles go through the kneecap into the tibial tuberosity on the tibia. That's the bump in the front of the knee there. Just get a big picture. And the test, you just have to label it. A lot of what we're doing is integration, so you'll be okay. Huh?
The one that you just said, the rectus?
The rectus femoris goes into the kneecap and then into the front of the knee, which is that tibial tuberosity place. It's not on there, the rectus femoris?
I don't know. Maybe I just...
Well, we gotta integrate them anyway. So that's the top one, and that muscle goes from the knee all the way up to the hip. So it's like the biceps femoris. The biceps brachii, it spans two joints. So it's the biceps does a little bit of this motion, not just bending. This muscle helps the iliopsoas a little bit. So if this muscle is really tight, you have a hard time stretching out the leg this way. So this is an important muscle to stretch because of that. When we take that muscle, no, we don't have to take it off yet. You see this bulge on the inside, this bulge on the outside?
Wait.
Next to them on the knee. Go by the knee. You see a bulge on the inside, a bulge on the outside. The bulge on the inside is known as the vastus medialis muscle. On the toe side, which is the middle. And the one on the outside is the vastus lateralis muscle. Those muscles are ginormous. They come all the way from the back of the thigh and reach over and go to the knee. That's why they're so big. And then we got one more. That makes it 3, right? We have 4. And the 4th is underneath. You can just see that the white structure here, and that's the vastus intermedius. Intermedius here. Vastus intermedius. Most powerful muscles in the body. Anti-gravity muscles. If those muscles, they're going to hold us up. If you're standing, they're always contracting a little bit, even though you don't think they are. But they're rhythmically contracting so you don't fall down. Because if they don't contract, you fall down. So that's why they're that big. Very important muscle. On top of that muscle is one little sliver muscle, which is really nice for test. Because it's right here. The nice sliver muscle. Goes from the ASIS on the inside and crosses the thigh and goes to the inside of the knee. Right here. And it's known as Sartorius. And the Sartorius means tailor muscle. And in old tailor times, when they say cross-legged, that's the motion. The muscle crosses the leg. The Sartorius crosses your leg. That's the leg crossing muscle. Sartorius. And that pretty much lets us be with the knee. We have one more little one. We don't worry about that. The popliteus. It's more clinically interesting. But then we go to the calf. And we go to the calf. We make compartments in the calves, the way we look at the calf. We have a compartment on the front. We have a compartment on the outside, lateral. So front by the bone, by the shin bone, lateral, then medial, deep by the shin bone, and then the gastroc on top. Remember the calf muscle on the back, the fat one, the big one. So those are the 4 places where we look in the leg. The first one to take off is the big ones in the back. We all can recognize those. And those are known as the gastrocnemius. Here we go. The 2 bulges. You can see the 2 bulges, gastrocnemius. If you take those off, or actually you can take one of them off, right there. Underneath you got a fat muscle, and that muscle is known as the soleus. So the gastrocnemius is on top, overlaying a deeper muscle that's the soleus. Soleus is not on the list?
No, thank God.
Oh, good. Should be.
Wait a minute. Which one? What is it called?
Soleus.
Soleus.
You know, like,
Nope, it's not here.
oh well. I can always add it. No. Well, both of those muscles go into the Achilles tendon. And they both are responsible so we can stand up like that. Go on the tippy toes. That's what they do. So they're very important because of that. So then we take those muscles off. And then look at the skinny leg. We got a skinny leg. Now we got a outside, a front, and a deep on the inside. So when we look at the anterior compartment, that's here in the front, we have a few muscles we're looking at. We have a tibialis anterior, an extensor digitorum longus, and an extensor hallucis longus. Digitorum means fingers, hallucis means toe, big toe.
Oh, wait, yeah.
Fingers and toe is the same name, digits. But in the hand, the thumb means pollex, and in the foot, we call it the hallux. Hallux valgus is where the toe is bent. We're People know that sometimes. So the one muscle I want you to know for the test on that is the tibialis anterior, and that's right by the bone. It's right by the shin bone.
Which one's that? So tibia.
Tibialis anterior is right by the shin bone. It goes to the big toe. Looks like it goes to the big. It doesn't, but it looks like it goes to the big toe. Tibialis anterior. The extensor digitorum longus and extensor hallucis longus, knowing that they're right here, they're going to extend those feet upward. So that's why extensors. Oops, we're going to have the flexors. But those aren't on the test because it gets too complicated. Then we have the lateral compartment. Now, on here you have a muscle you can take off. You can pull out. I want the one next to that. That long muscle going down, up and down here. See that? Goes right behind the lateral malleolus and actually goes underneath. That lateral compartment muscle is known as the fibularis muscle. Fib because it runs by the fibula.
It sure does.
It's good, huh? The old name for that muscle is peroneus. So if you see peroneus somewhere, you know it's the same thing. But we don't worry about naming it peroneus. We just go with the new name. Fibularis is much easier. I know. This is a muscle that you mess up when you twist your ankle.
Oh, that's the answer.
Oh, that was an answer. So it's right here. If you twist your ankle this way, the muscle goes into here. It's going to stretch it. It's going to hurt it. And a lot of it goes underneath, so it's really going to stretch it. And then when this is on stable wobbly, this muscle protects that wobbliness. And so it gets really strong. So clinically, you want to associate that with twisted ankle if it hurts here, because you can always massage it a little bit and release it a little bit and push it down. And then that gets me to the last slide, I think. The posterior compartment in the deep posterior compartment. And there we have the posterior tibialis, the flexor digitorum longus, and the flexor hallucis longus. And those are the muscles deep inside of here. And the posterior tibialis muscle is not the one by the bone, it's actually the one next to the bone. So it's the deep one on the inside. So if you look at the posterior compartment, you the deep one, you have like a muscle there. You got the red and yellow going up and down, right? Those are the vessels going up and down in the nerve.
Okay.
And so you have one right next to it and the other one right next to the other one. Those are not the ones I want. The one as you go into the kneecap, into the back of the knee area, not kneecap, back of the knee area. That's the one I want.
Which one is it?
Tibialis posterior. Comes out there. It gets a little complicated which one is which and then how it looks, so I'm not going to worry too much. Normally what you can do, like on a cadaver, you can go and follow the tendon.
Oh no, we don't want such a
You could do that. But you know, then you really know what you're doing. Yeah, I know the cadaver thing. Anyway. So that's the tibialis posterior muscle, and you can understand that the other ones going underneath, they go underneath the foot, they're going to flex the toe, or they're going to flex the finger. I mean the toes, the big toe and the toes. So the ones on top here are going to be extending it. The ones that go deep underneath it here, they're going to flex these elements. Does that make sense? Good. That's it. Any questions for that?